in.
Hi, my name is Essie. I'll be your nurse for today. I'm coming to do a head to toe assessment on you. Can you tell me your name and date of birth?
Alexis Williams, 1695.
Alright, I will wash my hands, perform hand hygiene, and provide privacy. Can I see your wristband? Thank you. Can you tell me what brought you here today?
Just a physical.
Okay. Can you tell me where you're at?
Atrium Hospital.
And can you tell me who the president is?
Joe Biden.
Alright. She told me who she is, where she is, the situation, and the time. I'm gonna start off by looking at your head, looking at your facial features. All of them are symmetrical. I'm going to palpate your head if that's fine with you.
Yes.
So I'm gonna touch. I'm gonna look for any masses, lesions, any bald spots, alopecia. Do you have any tenderness when I do that?
No.
No. All right. I'm going to do you have a history of having headaches?
No.
Do you have a history of seeing things? Do you wear any eyeglasses?
No.
Do you have trouble hearing?
No.
Smelling?
No.
Swallowing?
No.
All right. I'm going to look in her ears, check for drainage, or any redness. Her eyes are symmetrical. All right. I'm going to check for pearl. Her pupils are a size 5. So I'm going to shine a light in your eyes, okay? Her pupils are equally round and reactive to light. I'm going to. Can you press on your nostril for me and breathe in and check the other one for me? I'm going to check her nasal mucosa, pink, moist, and intact. Open up your mouth for me, stick out your tongue. Her oral mucosa is pink, moist, and intact. She has good dental hygiene. Her gum are tightly still around her teeth. All right, I'm gonna check for JVD. Her head will be at a 45-degree angle. Can you turn your head side to side for me? Thank you. Can you lift your head up for me? Her trachea is midline. Can you swallow for me? Do you have trouble swallowing?
No.
All right. I am going to now do a cardiac assessment on her. I will start by going to the second intercostal space, which is the aortic valve, and I will laterally slide over to the pulmonic valve. Third intercostal space, Earl's point. Fourth intercostal space would be tricuspid. I will ask her to lift her breast up. I'll go mid-clavicular to her mitral valve, and I would wait a minute and listen to it. And then I would check on the bell side of the scope in the same order for murmurs. I heard S1 and S2 and no adventitious sounds in her heart valves. Now I'm going to do respiratory. I'm gonna check for her lungs, but before that, I want to ask you a question. Do you have a history of chest pain?
No.
Yeah. All right. So now I'm gonna listen to the right upper lobe, left upper lobe, right middle lobe, left middle lobe. And it's just laterally the right lower lobe and laterally left lower lobe. All right, I'm gonna get you to bend forward and I'm gonna do your back side. So this is left upper lobe, right upper lobe, left middle lobe, right middle lobe. No adventitious sound throughout her lobes. Her breathing is eupnea. Respirations are 14. I'm also going to ask her, do you have trouble breathing?
No.
All right. I want to teach you about the incentives barometer, which you will take a deep breath into, and you'll do that 10 times an hour, preferably during commercial breaks. And I also want to educate you on the turn, cough, deep breathe. You'll just turn, deep breathe. You'll take a deep breath, turn, and cough, and they both help clear up extra mucus that's in your body. All right. Can I see your nails for me? Do a capillary refill. Check for edema. Check for body temp. And while I'm up here, I'm going to do range of motion. So I'm going to do elbow. Can you do like this for me? That's flexion, extension, and I will do that laterally. So with the forearm, I'm going to get her to do supination and pronation. Okay, and I will do that bilaterally. So now I want you to lift your arms up for me, like you flexing. Flex your nail muscle. That is pull. Now I want you to push against me. Pushing. Ooh, you strong. She got a grade 5. All right, now I'm gonna go down. I'm gonna drop to her toes. And I would track her radial pulse up here. All right, so I'm gonna check capillary refills in all her toes. Her dorsalis pedis pulse, posterior tibial pulse. Check for edema. All right, check body temp. Now I'm going to do her range of motion for her feet. So can you point your feet upwards? Upwards. There's dorsalis flexion and down for me. There's plantar flexion bilaterally. Now what I want you to do is I want you to push towards me. She's pushing. Pull towards me, that push and pull. She got a grade 5. Do you have a trouble with your range of motion or lifting or walking at all?
No.
All right, now I want to go back up because I forgot abdomen. I want to check. First, I will look and make sure I don't see anything that's abnormal. And make sure her stomach is flat. It can be a little round. It depends on the person. So her stomach would be normal, and I would check for incisions or any surgeries. Do you have trouble going to the restroom?
I don't.
Can you tell me when was your last bowel movement?
This morning?
Do you have burning when you urinate?
No.
All right, now I'm going to listen. All right, it's right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And if I didn't hear anything, I will listen for 5 minutes in each quadrant. Now I'm going to palpate. Do you feel any pain?
No.
Alright, so now I'm gonna get you to stand up for me and close your eyes. Alright. Now I want you to do heel toe for me. So I want you to walk, put your heel to your toe. 4 step this way and 4 step backwards. Okay. Now you can have a seat for me. I want to educate you about the Raven scale that is to check for Marshall, friction, shear, and pretty much they help with your skin integrity to make sure you don't be at risk for any pressure ulcers or anything. So I'll make sure your head is 30 degrees or less, and I'll make sure you have, dry linen, and make sure you be turned every 2 hours. I also want to educate you on the Glasgow's Coma scale. That is to test you for verbal, motors, and speech, and eye movement. So you talked to me, you did have good motor skills, and your eyes did move simultaneously when I did your purling. Also, I need to check for your skin tugger. Okay, let me check right here. Patient has good hydration. Her skin is appropriate for her ethnicity. I might say that wrong. Her hair on her legs, body are distributed evenly. Have you always like had not too much hair down here? I also would tell her that I believe that is all. So I will let the doctor know if you need anything, just give me a call.
Yes, ma'am, thank you.